My name is Lillian Oko. In this group are Elizabeth Ngasa, Cordelia Akbadua, Barbara Terry. Our topic is language barrier in health care, and I will be presenting the patient story.
Patient story. Mrs. A.E. is a 78 years old African woman who migrated to U.S. from Nigeria to visit her daughter for the first time. During her 3-month stay in U.S., she was admitted into the hospital, LAUSC Medical Hospital, on medical and telemetry unit for irretractable chest pain. She was admitted because the cardiologist who saw her at the emergency room wants to perform a thorough cardiac workup because of her age and symptoms she presented. She has difficulty understanding and speaking English. Her primary language is Igbo. According to her chat record, she has only one daughter who is a widow and her grandchildren. The daughter was not able to stay with her in the hospital because of babysitter issues, but visited her every day. Due to the language barrier, she felt nervous and was answering every question by nodding her head. To a nurse that speaks the same language with her on that special day during primary care team rounds. Meanwhile, in her chat, she was documented sometimes as being disoriented. During a conversation with the nurse, Mrs. A.E. was not confused, but due to ineffective communication and language barriers, it makes her care quite difficult.
My name is Cordelia Padua, and I will be presenting the domain of our project. Providers are increasingly faced with difficulties providing efficient care to multicultural society complicated by language barrier issues. Ensuring safe and adequate health care for all patients requires that provider understand how patient's socio-cultural background affects his or her health beliefs and behavior. Miscommunications in healthcare can be life-threatening. When communicating the details of a diagnosis or treatment, it is crucial to convey accurately the associated risk factors. For more complications, people from different cultural groups describe pain and distress quite differently. Culturally, specific terms, expressions, or metaphors can be difficult to navigate, even when language competence is very high. When providers lack the linguistic and cultural skills needed and interpreters are not available, patients may have to rely on medically inexperienced bilingual relatives or non-medical staff, compromising quality of care and worsening health outcome for migrant communities. Effective provider-patient communication leads to an increase in patient satisfaction, better compliance, and improved patient outcome. In multicultural population like Mrs. A.E., whose primary language is Igbo, the issue of communication may play an even greater role because of cognitive, linguistic, and cultural barriers that prevent effective patient-provider communication. A.E., in this case, her care was disadvantaged because of language barrier, but because her family was not available to assist with the interpretation, and the lack of interpreter service at the hospital further made her care even more difficult. Levels of interpreter services among the practitioners need to considerably improve. Occasionally, interpretation is provided by family members, as in the case of Mrs. E., whose daughter translated when she was available. This is not necessarily the most optimum route.
My name is Elizabeth Ngasa. I'm going to present language barrier in healthcare. Providing safe and quality care is an essential role of the healthcare system. African Americans make up about 13.4% of the US population, and a significant proportion of this population has limited English proficiency. This is evident in the case of Ms. A.E. Language barrier. It is a vital cause of ineffective healthcare provider-patient relationship that negatively affects patient satisfaction. For instance, Ms. A.E. care is already compromised from the initial patient's assessment. The language barrier resulted in an ineffective evaluation, and the patient is cited as sometimes disoriented when actually she is not. Language barrier negatively impact the aspect of patient-centered care, where patients are appreciated as the sole decision makers in their medical care. In patient-centered care, healthcare providers share information with their patient about patients' diagnosis, treatment option, benefit, and risk, thus enabling them to make informed choices. If a language barrier exists, healthcare providers usually attend to patients. Healthcare providers actually attend to patients' knowledge based on its language barriers. Exist healthcare providers on their knowledge and the best practice available. Thus, evidence-based practice is also hindered. Besides, the language barrier causes distrust of the healthcare system and a perception of discrimination within the healthcare system, which cause low utilization of healthcare resources. All these factors lead to poor healthcare outcomes factors, and by such which poor healthcare comes among racial minorities, thus causing further healthcare disparities. That comes to the end of my presentation.
Hello, my name is Barbara Terry. I'm going to talk about potential solution on language barrier. Since Mrs. A.E. understands only a little bit of English, she should be able to use Google Translate in minor situations. The app will help her understand the words that are difficult for her to comprehend so that she does not become nervous when answering questions. In case there is need for longer and more complex conversation, the hospital can make use of interpreter services. This is assuming there are no staff members or interpreters at the hospital who understands Igbo. The interpreter services are available on call. An interpreter can be sent to the hospital for the best result, as communication will be more effective. If there is an emergency and there is no chance of waiting for an in-person interpreter, the hospital can use telephone interpreter service or video conference. The doctors would simply need to dial the number and an Igbo-speaking interpreter would be made available. Apart from those, Mrs. A.E.'s daughter can be asked to help interpret in minor cases, like obtaining general information. This is to prevent against distortion of information in assessment. For instance, she may edit Mrs. A.E.'s response for suitability without realizing that she is distorting medical information. However, due to her lack of availability at night, the hospital may need to hire an interpreter for the duration of Mrs. A.E.'s stay at the hospital. This will make conversation easier and more possible at any time.
In conclusion, healthcare organization can support training that involves active practice and reinforcement. A provider who communicates effectively creates stronger relationship with patients, minimizes the risk of complaints to the organization, and provide better patient outcomes. Thank you for listening.